Hello, my name is Balakrishnan Rajagopal. I'm a professor of law and development at MIT and also the UN Special Rapporteur on the right to adequate housing. I'd like to actually say a few words about the antibiotic resistance project, which is one of the most impressive projects that I've seen in this cycle of funding at the Buffett Institute. The antibiotic resistance issue has emerged in a major way globally in the last few years, as we all recognize that it's one of the biggest threats to global health, food security, and development today. And the problem is widespread. It's an issue that we find around the world and an issue that affects everybody, people of any age in any country. We need to understand it more, and we need to understand its impact on many different dimensions that affect us, particularly on health, but also on food security, and more broadly on human well-being as we understand through the Sustainable Development Goals today. A growing number of infections now are becoming harder to treat as antibiotics are becoming less and less effective. And I think this project does a wonderful job of trying to frame the issue, to try to develop a multidisciplinary understanding of it, and then to collaborate with institutions in Pakistan and to develop a more grounded understanding of how this problem actually rolls out in other contexts. And I think that projects like these are very important for advancing the course of science and for advancing our attempt to ensure that sustainable development goals are realized for everyone around the world. And particularly timely is this project coming at a time of the global COVID-19 pandemic, as we understand the power of microbes. And I believe that this project will definitely contribute another dimension to our understanding and attempt to deal with this problem. So good luck with this project, and I wish you all the best. Thank you.
Thanks so much, Raj. And now I'm pleased to introduce the leaders of the Antibiotic Resistance Working Group, Northwestern Feinberg School of Medicine Assistant Professor, and Anne and Robert H. Lurie Children's Hospital Attending Physician in Pediatric Infectious Diseases, Dr. Mehreen Arshad, and Northwestern McCormick School of Engineering Assistant Professor of Civil and Environmental Engineering, Dr. Erica Hartman, who are here to present their project. Mehreen and Erica, welcome. And before I turn things over to you, I want to remind everyone that we will have a chance to ask questions of Mehreen and Erica and the whole team. So please drop any questions that come to you as you listen to their presentation into the Q&A box at the bottom right-hand corner of your screen, and we will try to ask those. Thanks so much. So over to you, Mehreen and Erica.
Thank you so much. I'm going to share my screen. All right. Well, thank you so much for inviting us. I and Erica are very, very excited to be part of this idea dialogue and really thank the support that the Buffett Institute has provided us. Antimicrobial resistance is really a global threat. Within the US alone, this is the CDC report from 2019 showed that there were more than 2.8 million infections caused by antibiotic resistant bacteria and fungi, with at least more than 35,000 deaths. And then in addition to that, antibiotic use also resulted in Clostridium difficile infection, which is the severe diarrhea that can happen in response to antibiotic use. And there were further, more than 12,000 deaths related to that. And we also know that antibiotic resistance spreads very easily across the globe. Prior to the pandemic, it was thought that more than 1 billion people cross international borders every year, including more than 350 million travelers into the US alone. And so antibiotic resistant bacteria from anywhere in the world can very easily travel to other parts of the world in a very short duration of time. This was a study that was commissioned by the UK government a few years ago, and they estimated that if antimicrobial resistance continues at the pace that it is right now, and we do not have innovative and effective strategies to counter antimicrobial resistance, we will be looking at around 10 million deaths per year that is attributable to antimicrobial resistance alone by the year 2050. And this will be more than all the deaths related to cancer combined per year, and is certainly significantly more than the 3 million deaths that we have had from COVID in this pandemic alone. So really, sort of getting to the point that if we do not do something about this problem right now, we are going to be looking at a lot more deaths and a lot more problems in the very near future. Unfortunately, a lot of the burden of that mortality is going to be in developing countries, but no part of the world is going to be spared from the severe consequences of antimicrobial resistance. The problem of antimicrobial resistance is not lost on the world leaders. And so in 2016, the UN held this high-level meeting on antimicrobial resistance, and global leaders committed to acting on antimicrobial resistance and to develop strategies. However, as we all know, committing to develop a strategy is very different from actually acting and implementing change. And so there continue to be significant gaps in our global strategy to counter this, this public health problem. In 2019, the UN Ad Hoc Interagency Coordinating Group on Antimicrobial Resistance warned, similar to the UK government study, that if drug-resistant diseases continue at the pace that they are right now, they could cost 10 million deaths each year by 2050, and the damage to the economy could be as catastrophic as what we saw during the 2008-2009 global financial crisis. And they also estimated, in addition, that by the year 2030, antimicrobial resistance itself could force up to 24 million people into extreme poverty due to a number of different reasons, which would include hard to treat and expensive to treat resistance and increasing healthcare costs. Unfortunately, we do know that overuse and increasing use of antibiotics is one of the leading causes of development of antimicrobial resistance. And over the last couple of decades, there has been a significant increase in the use of antibiotics pretty much across the world. There are some parts of the world, such as the US, Canada, where there has been some decrease in the use of antibiotics. But if you look at the map over here, most parts of the world, especially in low and middle income countries, there continues to be a significant rise in the use of antibiotics. And studies have shown again that this use of antibiotics is not appropriate use of antibiotics. So there's really just a lot of overuse of antibiotics without impacting disease in these areas. So really, as we all know, antimicrobial resistance is a global problem, and we really need to have a transnational, innovative, multidisciplinary solution to be able to combat this global problem.
So we acknowledge that this is a global problem, but we have several issues that prevent global solutions to this problem from emerging. One of the biggest ones that we identified is limited access to patient level data. And that's because different institutions and even different groups within the same institution collect different types of data and format those data very differently. This makes it incredibly difficult to draw general conclusions at the institutional level or higher. So even just within an institution, it's difficult to compare different data types. And since this is such an international problem, it's increasingly difficult every time you sort of go up a level to collect data and make sense of it. Another major issue that we identified is that diagnostic testing can sometimes be more expensive and certainly takes longer than just prescribing an antibiotic. So, somebody comes in, they're sick, it would take a long time potentially, and potentially more money than just prescribing the antibiotic. to help this individual, to just give them an antibiotic. However, the global costs of this sort of decision-making may prove to be short-sighted, and the global burden may be very high given the spread of antimicrobial resistance. So our vision thus is to, I don't know if Maureen, you can advance the slide, sorry. Our vision is thus to create a global collaboration to coordinate responses to antimicrobial resistance across academic, political, pharmaceutical, and medical institutions. This is really a multifaceted problem that involves a lot of participation from a lot of different stakeholders to make achievable solutions. So by using the data that we collect and coordinate, we're hoping to be able to forecast, detect, and prevent the emergence of antimicrobial resistance in communities before it becomes a major untreatable issue. We also hope to clarify the role of existing and new diagnostics and increase their use such that we'll be able to rapidly identify antimicrobial resistance, supporting better clinical decisions about the use of antimicrobials or alternatives, and potentially novel approaches to treating patients, thereby preserving the long-term efficacy of existing antibiotics. So incorporating both alternative approaches and existing approaches. We also expect that by looking at the system as a whole, we'll better understand how people make decisions around antibiotic prescription and non-antibiotic interventions to treat infectious disease. So what's really driving physicians to prescribe antibiotics, what's pushing patients to request these antibiotics, and what types of interventions would be most effective in terms of communicating what we can do about it.
The objectives of our proposal are twofold mainly. One is to develop an infrastructure to evaluate antimicrobial resistance across two different healthcare systems. And so this is going to be a collaboration between Northwestern University and the Alcorn University, as well as the Oregon National Lab. We aim to share existing data on microbiology, antibiotic use, resistance, and clinical outcomes, and then also collect additional patient samples to understand the burden and transmission patterns of resistant bacteria. And then secondly, we want to understand how healthcare providers make decisions around antibiotic prescribing. And for this, we want to be able to conduct interviews and focus groups of community providers, and then design and implement behavioral interventions that are really meaningful and culturally sensitive, and then use processes to monitor how those interventions are working. So our immediate term activities, which are basically in the next 1 to 2 years, are sort of divided into the three main categories. One is to share data between 3 individual hospital systems in 2 global regions. So in Chicago, we will be sharing data from Lurie Children's Hospital and Northwestern Memorial Hospital, and then from Karachi, Pakistan, we will be sharing data from the Alcorn University Hospital. We aim to develop an electronic standardized data collection system, and then focus on high-risk patient populations and individual clinical settings that may be relevant and may be a high yield for our proposal. We also want to be able to initiate a biorepository of pathogenic resistant bacteria, and then collaborate to conduct whole genome sequencing of these strains of interest, and also develop bioinformatic strategies to analyze these data. And then we want to be able to match the standard resistance testing results that are available in a lot of the clinical microbiology labs across the world to the genetic sequences of those strains. And that will help us in determining the role that sequencing-based studies and surveillance methods can be used in, in prevention of antimicrobial resistance. Secondly, we want to conduct a pilot study to understand the burden of colonization with resistant bacteria in patients and their environment. And for this, we want to collect relevant patient samples to determine how many individuals may be silent carriers of these highly resistant bacteria. And then we'll also collect environmental samples from those patients, or samples from the environment of those patients, such as drinking water, hospital surfaces, etc., to determine how many resistant bacteria are found in these patients' environment. And then finally, we want to be able to determine the role that silent carriers of resistant bacteria may have in infecting other individuals around them and or their environment as well. And then finally, we want to study the antibiotic prescription and use in the community. And for this, we want to survey clinicians to discover factors that might influence their prescribing behavior. We will also be conducting interviews of patients and their families to understand attitudes and experiences with antibiotic prescription. And then we want to identify culturally appropriate behavior-based prescribing interventions. And then we want to develop these processes where we can do these interventions and then study the effect of this intervention on prescription practices as well as antibiotic use in the community.
Our long-term goals are first and foremost, since we've heard from so many people today how important it is to take this to a global scale, is to really expand on our existing partnerships to make this a truly international global effort. In addition, we want to use our increased understanding to take a proactive approach to managing antimicrobial resistance, so that instead of being reactive and changing the way we behave based on existing antimicrobial resistant infections, we're going to establish a forecasting system to be able to issue warnings and suggestions for best practices before these issues get really out of hand. And we will, oh, sorry.
I'm sorry.
And we will develop a model that describes decision-making in the antibiotic prescribing process and can be used to identify the perverse incentives and or time cost trade-offs and suggest systematic changes. So this potentially includes things like changing the interface that physicians use in order to make prescriptions, making it easier to select shorter courses or alternatives to antibiotics, or potentially identifying opportunities to alter the financial models that currently prioritize prescriptions over diagnostics. So in summary, I think we can all appreciate that antimicrobial resistance is a global public health issue, and that to tackle the multifactorial causes of this issue, we urgently need a robust transnational and multidisciplinary approach. And we hope that we've provided infrastructure to get to that approach here. We propose to develop a collaborative effort across academic institutions from 2 distinct global regions with a focus on development of an infrastructure, which we think is critically important for data collection and sharing. We're also collecting pilot data for future collaborative grants, since this is such a large and important issue and we expect to expand in the near future. And we hope that all of this will contribute to understanding antibiotic prescription and use in the community and ultimately help curb the spread of antibiotic resistance worldwide.
Thank you. Thank you both so much. This was really thought-provoking. Obviously, this is very important and very innovative research. And I just want to remind everyone that I'm sure you have questions. If you have questions, stick them in the chat and we will ask them. So maybe just to kick it off, Erica, first, the rest, I think some of the other members of your team are here. So let's invite them to join us. Dr. Egon Ozer and Dr. Faisal Mahmood. Egon is an assistant professor of medicine, infectious diseases at Northwestern Feinberg School of Medicine. And we're delighted that Faisal is joining us from Pakistan, where he's an associate professor of infectious diseases at the Aga Khan University in Pakistan. Welcome to you both. And now maybe I'll just kick it off since we have Faisal here. I'd love to hear a little bit from you all about the relationship with Aga Khan University and the partnership with and why Pakistan, and how you expect that working on this collaboratively with such an eminent hospital in Pakistan will impact the work that you're doing.
Thank you. May, do you want to go first, and then I can take up from there?
Sure. Yeah. I think it's Pakistan is one of those countries that has a very high burden of antimicrobial resistance in the community, and so I think it is a perfect opportunity for us to learn from really providers and folks and researchers in Pakistan on how they're dealing with some of the antimicrobial resistance, and then also use some of the strategies and the technology that we have in the U.S. to study this global problem that we certainly see in Chicago a lot as well. but maybe not to the same extent as that's seen in Pakistan.
And also, I mean, it's a very different environment over here compared to the US, where I've worked also, and how these two would gel together is really interesting to see with our unique and combined problems also.
Fantastic. Well, it'll be exciting to see how that develops. That's great. So we have a few questions coming in, and two of them are related. So I'm going to pose them together and open it up to you. The first is, do we know the extent of over-the-counter availability of antibiotics globally? And the second is, I think related, are you interested in looking at marketing practices of pharmaceutical companies related to these antibiotics?
So I don't know if any of the other folks in this panel have an idea about the extent. I can tell you that there is a lot of overuse of antibiotics and over-the-counter access to antibiotics, especially in places like Pakistan and in many developing countries where there isn't a robust healthcare system in place. And we haven't, and I think as part of our community outreach to some of the providers in Pakistan as well as here, I think one of the questions that we will certainly be looking at is how those antibiotics are marketed to these providers by the local pharmaceutical companies.
And I think just to add on to that, not just pharmaceutical companies, but also social media, which is something that Marion had written about also, which plays a huge part in antibiotic prescription here in Pakistan as well.
I think this also speaks to the sort of diagnostic versus drug trade-off, this idea of, if you can buy it over the counter, you don't actually need to go through the diagnostic process. And so being able to understand how much people are doing that and skipping the diagnostic process versus how much the diagnostic could contribute to really ameliorating the entire process, I think that will be really important.
Interesting. Another question is, does the group anticipate that antibiotic resistance will be culturally or socially specific in any way? What differences do you anticipate that you will find between Chicago and Karachi? Do you have thoughts on how you will incorporate this cultural variation into the project?
Yeah, I think that there will be a cultural difference. I think we may be surprised that a place like Chicago may have some of the same challenges when it comes to expectations from both providers and as well as families in terms of antibiotic prescribing for simple things like viral diseases and common colds. And I think one of the interesting things. So I spent 10 years in Durham, North Carolina, practicing and training over there. And the population over there is a lot more homogeneous than it is in Chicago. So we have a very robust immigrant population, many different ethnicities, races. So I think that we are sort of, Chicago is this sort of microcosm of world cultures that I think will be really interesting to look at the cultural aspects of antibiotic use over here. And then I think Faisal, I don't know if you want to speak more to sort of what you might expect in Pakistan.
Yeah, well, so we know that the bugs are sort of different. The resistant bugs we see over here that we see in the US are slightly different in how they are, but culture is an important part. For example, when somebody goes to a general practitioner over here, they expect to get an IV, otherwise they haven't been treated. And that sort of is an important part, and actually has led to outbreaks of HIV in the community also because of this.
Yeah, this is a problem in the United States as well, where a lot of providers want the strongest antibiotic, and it's not necessarily always the appropriate antibiotic, and that can be very culturally based. Sounds like it's maybe a universal phenomenon.
Interesting. So Egon, maybe I'd love for you to say a little bit about your angle on this project, because I have to say, it's the first time Northwestern Buffett to my knowledge, has had an occasion to engage with the kinds of methodologies that you work in. So what will be your work on this team?
Yeah, my role will be assisting with developing the practices for biobanking, but also for specifically for whole genome sequencing of the different microbes that are collected. And the idea being that if we have a better idea of the mechanisms that are causing resistance and how they differ between places like the United States or Pakistan, and what are the predominant mechanisms of resistance, and we'll have a better idea of what we should be looking for when we're doing testing, and whether the antibiotics that are being prescribed, even if they are phenotypically appropriate, whether they actually are when we're looking at what the genotype is, what the actual organisms are expressing. And I think we make a lot of assumptions about what are the predominant mechanisms, but without actually looking at sequences, really going down to the genomic level, we don't really know what distinguishes a resistant organism here from a resistant organism in Pakistan. So by collecting this data and developing methodologies for kind of democratizing how that data is collected and universalizing it, so that what we're doing in the United States is similar to what is being done in Pakistan, I think that we have an opportunity to collect a lot of data that will be very important going forward for understanding transmission of these organisms, mechanisms of resistance, and then really how to develop next generation diagnostics to really understand very quickly what kind of infections are being dealt with and how best to treat them.
Great, thank you. And I should mention that Egon directs one of the centers at the Institute for Global Health at Northwestern Feinberg. And so we're excited to partner with Northwestern Feinberg's Institute for Global Health with this project. We have time for one last question, and it's from Northwestern Buffett Board of Advisors member Sunil Kamlani, who asks, since the issues differ from culture to culture, do you anticipate at all considering including other regions in your study? And also, are you examining access to healthcare, such as public, private, or insurance paid, as a determining factor in overuse?
Yeah, I think that's a great question. I think really we are hoping to use the collaboration that we build through this current proposal to really then expand to other regions of the world. I think some of the, so we have some collaborations in Africa as well as in other parts of Asia that I think we can very easily, include in our proposal once we have this basic infrastructure set up between the current two regions. And then I think that, I'm sorry, I forgot what the second question was.
I think one of the, the insurance, public versus private, I think that falls under the category of factors that we were concerned about in terms of cultural drivers of antibiotic prescribing and people taking antibiotic behavior. So we're absolutely interested in those questions, and the things that we don't get to immediately, we hope to get to in the longer term.
Yeah, I think in our third part of the project, we also want to interview families and patients and really try to understand what their drivers are for asking for asking for antibiotics, even for simple colds.
Okay. Wonderful. Well, thank you all so much. We are thrilled to support this critical work and can't wait to get updates on what you're finding.